So I've been going over a lot of concepts in the Innovator's prescription by Clayton M. Christensen, and this is a continuation of that. In the last episode, we took a look at the problems with the healthcare system in general, and specifically we went into the details of the fee-for-service model, where the patient pays out of pocket for a service that's rendered by the doctor or the hospital. Now, in this episode, we'll be taking a look at the insurance-backed model and the problems that comes along with this particular model. So if you take the US healthcare system, it's primarily fueled by an insurance-backed model where services are rendered and then the insurance is then paid to the organization, and the patient pays a premium for the insurance and they have coverage, right? So I have a lot of friends in the US who are practicing doctors, and then they always tell me like it's really different from what they've experienced in India. And the main difference in thinking is that they've told me that when a patient comes to you, you don't immediately think what the patient really needs. You first think what insurance covers them, and then their whole thought process and the protocol and what they do is based on what will be reimbursed, right? So in a real sense, so what is happening here is that you have the patient, and let's say they have like a problem. They come with a broken bone or whatever. They go to the doctor, and the doctor, although is like highly qualified, they know exactly what to do. In the back of their minds, they're thinking, will this be reimbursed by the insurer, right? So in a very real sense, the doctor is actually delegating the standard of care and the protocol to an insurer who's sitting behind their laptop screens or their computers, deciding exactly what gets approved and what gets denied, right? So if you have a system where, again, the person who's actually making these decisions about what gets paid, they are not as qualified as a doctor, your natural limiting factor of the system becomes this person who's actually making the decisions, right? So in a way, the standard of care is actually set by the insurer and not by medical research and the doctor, who's actually probably a lot more qualified. And again, like usually most insurance providers stick to the standard of care set by research and they do whatever is needed. But then that's not always the case, and it usually lags behind the person who's actually making these decisions, and the protocols of an insurer usually lags behind at least a few years behind like what the best possible care for some patient actually is. And then it's not going to cover the niche cases where something might actually be good for a very specific small group of patients, but then since the insurer can't be bothered to actually look at that subset of patients and actually like come up with a policy for them, they're just like, okay, we are not going to do this, we are not going to approve this particular procedure that you did on this patient, although that we know that it might help the patient. They just like, it's not under their policies, so they don't cover it, right? So that also brings us to this other problem of really expensive out-of-pocket expenses, right? Like, so it's hilariously expensive how certain procedures in the US cost. And a reason for that is because these prices are heavily inflated because it's going to be paid by the insurance anyway, and the patients very rarely actually do these out of pocket, right? So when it's the insurance, and sometimes this is even the government coming into the picture with insurance programs like Medicaid and Medicare, when they are setting the rules with the hospitals, everyone on the system, especially on the hospital side, they are incentivized to set extremely high rates so that that same rate gets reimbursed by the government or the insurance provider, and you have this artificially high price that everybody has to pay, even when it's the patient who's actually paying it out of pocket, because they have rules stating that you need to set the prices to an insurer almost the same as what you set to your end customers if they're buying it directly from you. So what do? They just like increase the prices of everything that they sell directly to the customers, right? So again, here we also come to this problem of limited choice for a patient. Again, like it's similar to this protocol driven approach where the insurer gets to decide whether the money goes or not. Again, the patient does not really have too many options, right? Although it may seem like there are a lot of practitioners who the patient can go to, most of them will probably not be insured, and they'll probably not be able to really access them as part of the insurance. So it gives the patient this false sense that, okay, everything that they want will be covered, but then certain specialists or certain actual doctors that they may want to go and see, or certain procedures that they may want to do, may not really be covered. And then again, with the out of pocket being extremely expensive because of these inflated numbers, which is like it's a competitive game between the healthcare system and the insurer. They also ensured that it's almost prohibitively expensive for someone to go out and receive private care, right? So the other thing that is also a symptom of the insurance-backed system is that they tend to overdo a lot of things. So they tend to over-investigate, they tend to over-diagnose, they tend to over-treat. And the reasoning is very simple. If you, again, we saw the Cobra paradox in the previous episode, but again, if you set the incentives in such a way that you get paid for what you do to the patient rather than keeping them healthy, people are just going to do more, right? So it's no different here. Again, you're getting paid per service. Like you have a whole set of codes for just procedures, right? And the procedure codes that are actually billed drive the hospitals and the doctors and their business. So they have a lot of incentive to actually do a lot more procedures. They have a lot more investigations done. Like for example, if somebody comes with like a sprain of the ankle, the standard of care in some place like India would just be like, okay, fine, take an X-ray just to see if they have a fracture. But in the US, it may be something like go do an MRI, right? Which although may cost a lot of money, but then the system is incentivized to do that because they're going to get reimbursed and they're going to get that money back. And that's how the whole system rolls. So you have this tendency to overdo almost everything. And sometimes it's even harmful, right? Like when you clearly don't need to do something, but you do it because you think that you can cheese the insurance system. There are whole different number of players, especially in the software game, who are available, who can like put the documents together and make sure that you get your claims from the insurer, because the insurer is again like they're only going by a certain set of rules and policies, and it's pretty easy to game if you really put in the data and like you actually try to get the money. So since there's a lot of money involved because of these inflated prices, you always have a lot of intermediaries. So in between the hospital and the insurer, you always have these intermediaries who either they are TPAs or they enable the hospital to actually get insurance from the insurer. So what again like ends up happening is that you increase inefficiencies, you increase costs, like somebody needs to pay them. So finally it's actually going from either taxpayer dollars or it's going from your insurance premium. So the whole system ends up being extremely expensive. There are some people just cheesing the system for their own benefit, and the doctor is thinking about what will be insured versus what will not be insured, rather than thinking what the best possible care for the patient is at that point. And the patient again, like they are limited in what they can really do, and if they do decide to go out of the system, they need to pay like a king's ransom to actually do something out of pocket, right? So all of these again, like it's probably there are a lot more issues that I haven't covered, but at least this is the basic issues that plague a system that's driven primarily by insurance. And I think the US is a very prime example of how things are working. So that's it for this one. And in the next one, we will take a look at government-backed healthcare systems. For example, like the NHS, where everything is done by the government. We'll see what issues happen in such systems. Again, I really urge you to go buy this book, read this book. I have absolutely no affiliations or anything of that sort. I just think it's a crazy good book to not read, right? So Do like check it out.